Mother of two. She joins us this morning from Baltimore. Julie, good morning to you.
Good morning. Thank you.
Okay, famously, the president did promise, you can keep your health care, but you can't keep your plan because you just got a letter from Blue Cross Blue Shield that said what?
Yeah, I did. The letter, actually, I have it with me. It said that, among other things, these ACA requirements will cause your benefits to change to include federally mandated essential health benefits. And since your current plan does not conform to these new mandates, your current plan will cease upon your anniversary date. So in accordance with ACA, you will be required to select a new ACA-compliant plan in order to continue your coverage. So I can't keep my plan. I mean, I can keep it for a little while, but, the letter goes on to say my options. I can keep it for a short time, but ultimately I'm going to have to pick a new plan. And I went on to the Care First website, which the letter directed me to do, and it's a really confusing website, so it was not easy to kind of hunt and peck around and figure out what they're trying to offer me, but basically the closest option I found to the deductibles and copays that I pay now is $214 more expensive every month for my family, so that's $2,500 plus a year.
That's got to be heartbreaking to you. You know, small business owner, mother of two, you're going to wind up paying, if you go with what seems like the best fit, you're going to pay $2,500 more per year. You know, the president promised you could keep your plan, he would drive down the cost, and so now to see the number, $2,500, it's like you must want to go, and complain to somebody. It's like, hey, this is not what we were sold. You got to do something about this.
Yeah, I mean, we've invited them in to legislate a situation where, we've asked them to correct some things for a lot of people. You know, I know some people that this has helped. I have a dear friend whose mother had a pre-existing condition and now she gets coverage, so I'm glad for her. But it's at the expense of my family and a lot of other families, so it's an imperfect law. Obviously, it's a hot mess. I think everybody would agree to that. It's a hot mess.
And one of the reasons that everybody's premiums are going up in many cases is because now they have to insure people who do have problems, pre-existing conditions, and all the prices are going to go up. Now, I'm sure you have done the math in your head. Okay, maybe I can't afford this. Maybe I'll just pay the penalty. What have you thought about that?
Yeah, my husband and I have considered it. We've talked a lot of times about how it'd be more cost effective for us to have no insurance, pay the penalty, and just suffer those consequences. But it's a risk, and with small babies in the house, it's a scary risk to take. I'm not sure that it's one that we'll take.
Yeah, no kidding. Well, keep us posted. Let us know what you decide: penalty or the $2,500 more per year, because we're curious. Julie Boswell, thank you very much for joining us today from Baltimore.
Thanks for having me.
You bet.